So, we are going to be doing a body scan meditation, part of our body awareness training today. So, all of you have already taken that lying down posture here. You can also do this seated or standing. Lying down just tends to be one of the easier ways. So, this is going to be one of the easiest forms of body scan. We could also do a progressive muscle relaxation meditation, which while we're doing this, if you choose to do that, all that is when we're focusing at each individual part of the body, you would tense the muscles in that part of the body, hold that tension, and then relax that. It helps to bring blood flow and awareness even more so, and control over one specific area of the body. But what we're really cultivating today is just awareness of the physical body. So, if you haven't already, letting those eyes close or having an unfocused gaze. We're going to start by bringing an attention to the breath, again, like we were doing earlier. So, either at the rise and fall of the chest or stomach, maybe at the back of the throat or the tip of the nose. Just an awareness of the breath to settle our minds and to settle our bodies. Cultivating that calm, that attention. And now bringing that attention down to your feet to start. Bringing in the awareness of the toes, maybe the middle of the foot and the heel. Taking note of any discomforts in this area of the body. Giving your feet your full, undivided attention for just a moment. And just asking yourself, what's happening in my feet? How do my feet feel in this moment? And bringing that awareness up to the ankles. Noticing if the ankles are trying to tell you anything at the moment. And if there is an area of discomfort and maybe a slight movement of the ankle helps release that discomfort, maybe taking that time to do so, but noticing with awareness what it feels like to move that ankle if you're going to. Just being very, very present with each sensation. And bringing that awareness up to the calf or gastroc as we know it. Maybe even bringing in that awareness of the shin, if there is an awareness there. If not, that's okay. You can cultivate that over time. But just noticing, what is this area of my lower leg saying to me? Maybe noticing comfort or discomfort. Maybe even labeling pleasant, unpleasant, or neutral sensations in this area of the body. What does the calf or lower leg have to tell you? And bringing that attention to the knees. What a lovely joint that holds so much of our body weight, that holds so much of our gait as we walk. How often do we listen to our knees? What are they trying to tell us? Maybe noticing if there's a little extra tension in the knees from the position that they're in. Right? Are they slightly tented with a bolster? Are they straight? Are they even slightly going backwards with our straight legs and no bolstering? What are the sensations in those knees? Is there a buildup of pressure, like the knee needs to pop and release that pressure? Is there some neutrality and lack of sensation? And again, continuing upward with our focus, and now bringing it to the thighs, the hamstrings, the quadriceps, maybe the IT band. Maybe gracilis is just screaming out, hey, pay attention to me. Just taking note of that upper part of the leg. Note of the tension or relaxation of those muscles. The positioning of that part of the leg. What is the upper leg trying to tell you right now? And following the body upwards again to the hips, glutes, and pelvis area. Right, there's a lot happening here. Again, it's what holds a lot of our weight when we're standing. They're muscles that join our upper and lower body together. This is our reproductive organs. Maybe even a little bit of that bladder sensation is going to be coming in here. What is this area of our body trying to tell us? Is there comfort in our hips? Is there tension? Are our glutes just nice and relaxed? Do they feel the pressure sensation of the floor pushing up against them? Are there pleasant, unpleasant, or neutral sensations in this area of our body? Maybe for those who are more energetic with their awareness, maybe there's something energetically here at the base of our spine. Maybe in that root chakra, maybe there's something that's trying to inform us of our physical experience through that energetic pathway. And for those of us who are more physically minded, maybe it's the tilt of our pelvis. Maybe it's our sits bone, what's happening there. And then flowing again upward with that awareness of sensations into the low back and abdomen. Maybe we're digesting our morning meal still. Maybe our stomach or intestines are telling us that we're hungry again for our midday or evening meals. Maybe our back is saying, ooh, this posture within our hips and knees is causing some low back tension. Maybe it's telling us, ooh, I feel so comfortable because of this posture. Right? It's not about right and wrong. It's all just about information. Maybe it's pleasant or unpleasant, but it's not right or wrong here. Right? Subtle differences there. What is our abdomen and low back trying to tell us? And moving upward again, noticing mid-back, upper back, chest area here. Right, bringing in the awareness of the lungs again as we're breathing. Bringing in the awareness maybe of the heart or pec muscles. Maybe our shoulder blades. Maybe if they're digging into the floor or not right now. Maybe there's a knot in our rhomboids or traps that are calling out to us saying, hey, we're really tight over here. There's some discomfort here. Maybe that mindfulness of the lungs and breath is coming back in saying, oh, I'm breathing more deeply right now, or oh, when I'm lying on my back in this way, I'm breathing more shallow. Again, not right or wrong, just information. We're noticing how do our lungs operate lying on our backs. We're noticing what position are my shoulders or chest in right now. And with that question of shoulders, maybe we bring that attention up just a little bit more to include those shoulders, right? Bringing in that glenohumeral joint. What is that joint trying to tell us? All of us in the room here are body workers. We use our shoulders and arms a lot. So maybe noticing, oh, there's some tension, there's some pressure there. Maybe like our knees, our shoulders just feel like they need to pop, or there's just a little room for movement in there. Now bringing that awareness to our upper arms from the shoulders. We're flowing down the arm here, noticing that upper arm. Biceps, triceps, deltoid, right? Maybe even some of those attachments as they are enacting what they do. Maybe you're somebody who has a little bit more awareness and sensitivity of the bone structure here. And flowing further down the arm, we notice that elbow joint. Very similar to that knee joint, right? But just a little different. Maybe you're noticing some tension there. Maybe we have a little symptoms of tennis elbow or golfer's elbow there, right? A little epicondylitis. And bringing the awareness down into the forearms. Again, as body workers, we hold so much tension in our forearms. Maybe noticing where that tension is sitting, if it's pulling on anything in particular. Or maybe there's no tension and your arms are just super relaxed. Maybe sending a little gratitude for that lack of tension. Maybe just noting that pleasant sensation. Oh, there's not tension today. That's pleasant, thank you. And flowing that attention to the wrists. Another joint for us that takes a lot of beating here. And flowing that awareness into the hands, right? Both sides of the hands. The anterior and posterior aspects of each hand. Maybe noticing the fingers, maybe one finger over another is calling out more. If it helps to do a little squeeze or movement of the finger to bring attention to one specific finger or something. Maybe it's the thumb that's bringing more attention. And following that attention line back up the arm, back to the shoulders to arrive at the neck. Right, this is where our throat is, our cervical spine here. We hold a lot of tension in our necks. We're carrying around this big bowling ball of a head all day long. What is our neck trying to tell us right now? Maybe there's some tension in the SCM or the scalenes that's really pulling that head forward from our phone use or computer use. Maybe there's more tension in the back of the neck, in those trap muscles that run up the back of the neck, the erectors that run up the back of the neck, inserting back there on the occiput. Maybe those are calling our attention more. And then bringing that attention now to the head. Maybe noticing first the back of the head and the scalp. Maybe noticing the ears and maybe around temporalis if there's any pressure there. And then bringing it to the face, all of those tiny little muscles of the face. All of those circular muscles around the eyes, around the mouth. Maybe those sinus passageways, the Etruscan tubes are calling our attention. Maybe the eyes themselves or the little muscles that move the eye back and forth, up and down, that help to focus the eye. Maybe that's calling our attention. Just noticing what our faces and our head has to tell us. And from here, zooming out your awareness, taking in the whole body at once. So noticing all of those little pinpoints on the map that we just visited as a full globe of the body here, a full map of the body. Right? We're real familiar with just this point and that point. So as we look further out, maybe those points are lighting up, calling out to us like lights on a switchboard, right? This light is coming up over here. Oh, there's a phone call coming in from the hand. There's a phone call coming in from the foot. Maybe we answer that call. What's happening over here? And then zooming back out. Oh, there's a phone call coming in from the nose. What's happening over there? Zooming back out, kind of taking it piece by piece. And this is more mindfulness of the body, mindfulness of body sensations. We talked about those two ways to approach it. Maybe we let it light up and call out to us and investigate what's happening, or maybe we rush into it before it lights up, noticing what's happening there. Right? Letting it come to you or going to it. Different ways of approaching that attention and awareness. And then now I invite you to release that focus. Release that attention. Let the mind wander a little bit. Notice if it's pleasant to release that control. Maybe it's unpleasant. Maybe you like the control. You like the pulling from place to place of the body. And then just as before, we're going to notice those touch points of the body. where the body is touching the floor or cushion. That pressure, that weight of the body against that floor or cushion. And we're going to listen for the third ring of the bell before opening our eyes and coming present to the room.